Good morning. I am Kevin Price talking to you about you and your business. We've got a lot to talk about on today's program. Do want to mention, of course, the tornado that hit Oklahoma. Came near and dear to a couple of my friends, in fact. Do be obviously praying for those folks out there, but also support organizations that are helping. I'm a big fan of Feed the Children, which, by the way, was 15 minutes from Ground Zero, and they were one of the very earliest organizations there to help. And so that's where I've been sending my support to feedthechildren.org. And we're going to have a spokesman on from that organization next week. But I don't care who you support somebody. We need to help our neighbors. And there's great organizations like the Red Cross, Salvation Army, and many others that are there on the front lines. And I want to encourage you to do that. Let's not forget about it. You know, the stories like this get a lot of headlines for 3 or 4 days, and then after that, they kind of fade away. But guess what? People will be living in tents weeks and months from now, I'm afraid. And so we need to keep that in mind. So Feed the Children, Salvation Army, I don't care who you support, but support someone who's going to help make a difference in that terribly damaged and destroyed area. All right, I'm going to talk about business because guess what? That's what this show is. It's a business talk show. I got Punit Dhillon. He's with a company called 222.Oncology. Is that how we pronounce it there, Punit?
It's called Oncology.
Okay, very good. And it is a health-related firm, home health-related firm. Is that correct?
Yeah, it's we're an oncology company actually focused on skin cancer development. Skin cancer therapeutics development. Sorry.
There you go.
And,
so, tell me about the company. Give me a little bit of background on it.
Yeah, so it's an exciting company based out of San Diego. We're focused on using this novel technology of combining two different components. One is a delivery component, and the other is this active agent that is a DNA-based approach that's stimulating the immune system to fight cancer. So we're applying a therapy locally to skin cancer tumors, but then you're able to get an effect that goes across the entire body by a local treatment. So it's a very novel approach, and it's only therapy of its kind that combines these two different components that's activating the immune system and getting you're harnessing your body's own immune system to go and fight cancer.
Okay, that's interesting. So how does that work? How do in layman terms? I don't even play a doctor on TV, so you gotta have to keep it simple for me. But how does it harness that and have that effect throughout the entire body? That's fascinating.
Yeah, so what we're doing, keeping it simple for the audience, what we're doing is we're delivering a DNA plasmid encoding a gene that's normally found in the body. We're delivering that locally into a tumor, and then that gene is then transcribed by the tumor cells or the cells, and it emits a very large immune response, or it ends up that gene is actually typically found in people, you and me. It works very well. It modulates the immune system. Unfortunately, in cancer patients, it becomes suppressed. So all we're doing is reactivating that important alarm bell for the immune system, and then it ends up harnessing other immune system components to go and seek out cancer.
Okay.
So it's like when if you go through airport security, if the alarm bell rang at the airport security, it would end up recruiting the TSA, the airport security, police, and so on. Same type of reaction. You do that at a local site, and then you're going to get a global response. If this happened at JFK, they will be notifying airport securities nationwide, if not global wide, and then you have the same kind of result here in the immune system.
Wow, that's fascinating. So let me ask you then, and so you know that this gene is inhibited while someone is dealing with cancer. You know that from research.
That's right. Yeah, it's usually it's still in the body, but it's definitely suppressed, and it's not helping to regulate the immune system any longer. And what we're doing is breaking that tolerance of the body and getting that reinvigorated again.
Okay, so where are you in the process? I'm assuming you've already gone through all the clinical trials and that type of thing, and where are you in relationship to the FDA? I realize it's neither a food nor a drug, but it does have, technological implications that I would assume there's, laws regarding making sure it's able to do what it says it can do.
Oh yeah, it's still a drug. Sorry, we're developing a novel pharmaceutical at the end of the day. The product is undergoing phase 2 clinical trials, and we're currently conducting 3 phase 2 clinical trials. One is focused on metastatic melanoma, which a lot of people can relate to and have heard of. The other 2 are 2 other rare forms of skin cancer known as Merkel cell carcinoma, and the other is cutaneous T-cell lymphoma. All of these 3 different cancer indications that we're working on are quite deadly. They have a very poor treatment options available currently, especially the latter 2 I just mentioned. And this approach is hopefully going to be a very interesting solution for people dealing with advanced stages of these diseases. So
where are you in terms of being able to actually treat people?
We are actually treating people right now. We're underway in 8 different clinical centers across the U.S. Our melanoma program is actually close to completion of enrollment. The other 2 programs are still enrolling patients. But what we'll be doing from here after 2013 is moving these programs to the next stage of development. And then we'll have more clinical sites, and that'll just be the process that we're going to be going through for approval.
Do you have your own facilities, or are you using it doing it always in conjunction with other people's facilities?
Yeah, all these clinical trials are being held at academic institutions and other cancer centers that are very well recognized across the U.S. They're all key centers of excellence for each of these indications, and we've had the luxury of also being able to work with the top doctors in the world on each one of these different cancers that we're working on. So we got a great collaboration here between what we're doing along with each of these different centers that have provided a lot of their own expertise. But we're based out of San Diego. Our headquarters are based out of San Diego.
Okay. Now you said you're in phase 2. How many phases are there before it becomes accepted practice?
There's 3 phases, and that's what you need to complete, meet the endpoints for each of these phases before moving on to the next one. And after phase 3, you end up filing for an NDA, a new drug application.
And so, go ahead.
Yeah, so we're still a ways to complete a phase 3 program, but our phase 1 and phase 2 studies, phase 1 study went very well. Our phase 2 studies are going really well. We expect these studies to wrap up this year and then move on to the next stage of development.
So, like the role of regulations in this, do you feel like it has any kind of inhibitor of the process, or is it actually helpful in the process? Tell me what kind of impact the regulatory environment has on this.
Well, the regulatory environment has been interesting. I think in our space there's been a lot of other companies that are in the immunotherapy space. I think so far we haven't had any obstacles with dealing with the regulatory bodies or the competent authorities. The FDA has been very cooperative. The other thing is that when you're working on certain diseases that have a very unmet need, or there's no medical options available for them or treatment options, then you can also pursue ways to fast track that process, and we're looking into that. For instance, on one of the indications that I talked about, Merkel cell carcinoma, unfortunately there's no standard of care for these patients. The only option they have is surgery and radiation. So we are one of the a few companies in the world that is focusing on a treatment option, and I think we're the only company that has an active phase 2 program underway that is recruiting and giving these patients another option other than standard of care. So that's where you can definitely use that to your advantage and move through the regulatory process very swiftly when you're dealing with deadly disease, especially that disease is actually 3 times deadlier than melanoma.
Yeah, wow, that's incredible. Got to wrap it up. Punit Dhillon, he is a doctor with Oncology I got it. Oncosec. There we go. Like oncology. There we go. It's not that hard, Kevin. Oncosec.com. That's ONCOSEC.com. Oncosec.com. And thanks so much for being with us.
It's been a pleasure. Thank you very much for having me.
Yeah, great topic. People need to learn more about it. You know someone who's been touched by one of these cancers, you might want to contact them because it sounds like they're making a difference. I'm Kevin Price. You're listening to The Price of Business.